There you are. Hi, Councilmember Ellis. How are you?
Doing good. For some reason, I was waiting on the other link.
Oh gosh, I know. I'm sorry. We're just filling up your dance card today.
That's, we have so many different ones, and
We
I've been
do.
on other Zoom this morning also. So whenever we are ready, it looks like we have quite a few people online waiting.
We do have quorum. We are ready to start whenever you are, Madam Chair.
Okay, thank you so much. Appreciate that. At this time, good afternoon, members of the MAGS Regional Domestic Violence Council. This meeting is now called to order. This meeting is being recorded and live streamed on YouTube and as a way for members of the public to participate. Please state your name when making a comment or asking a question. I will ask that you keep your microphones on mute when you are not speaking. We will now begin the meeting with a roll call of all members. Miss Amy, please.
Thank you very much, Madam Chair, members of the committee. When I call your name, please unmute and let us know your affiliation. Patricia Abiata Young. Celeste Adams.
Present, save the family.
Thank you. Zach Altman.
Present, Town of Gilbert.
Thank you. Emily Karen. Kayla Bab as proxy with Maricopa County Attorney's Office.
Present.
Thank you. Councilmember Ali Klein. Councilmember Ellis.
Present.
Thank you. DC Ernst. Mayor Friedel. Cindy Garcia.
Present with Chicanos por la Causa.
Thank you. Laura Gild.
Present with DES.
Thank you. Christine Hahn McDonald.
Present with City of Scottsdale.
Thank you. Elizabeth, let's see, Danielle Shager is proxy for Elizabeth Herbert. Samantha Hinchy.
Present, Aces DB.
Thank you. Councilmember Hodge. Cindy Patterson is proxy for Marilyn Kasanik.
Present.
Excellent, thank you. Emily, I did just see your message that your audio isn't working. Thank you for letting us know. Let's see, Patricia Clark. Councilmember Loretano. Andrew LaFever.
Present with ACJC.
Thank you. Kevin Mattingly. Kevin.
Present with the City of Phoenix.
Thank you very much. Councilmember Norton. Amy Offenberg.
Present with the City of Phoenix Prosecutor's Office.
Thank you. Carol Park.
Hi, present with Community Legal Services. My entire name is Carol Park Aiden. Not a problem.
Sorry about that, Carol. Yes.
No biggie.
Chris Charlo.
Present, City of Tempe, Care 7.
Thank you. Melissa Thomas.
Present, City of Glendale.
Thank you. Monica D'Ortenzio is proxy for Councilmember Tilke.
Present, Town of Gilbert.
Thank you. Did I miss anyone? Any council members? Madam Chair, we have quorum.
Thank you, Miss Amy. At this time, our next item is called to the audience. This is the opportunity for the public to comment on items that fall under MAG's jurisdiction that are not on the agenda, but that are on the agenda for discussion and not for action. Members of the public can submit written comments via the MAG website up to 2 hours prior to the meeting. Miss Amy, do we have any written comments for this item?
Madam Chair, there were no written comments submitted for the meeting.
Thank you, Miss Amy. And now we're moving on to item number 3. There are no information items for this meeting. Now, number 4, our next item is the approval of the October 3rd, 2024 meeting minutes. Does any member of the council have questions? Staff, do we have any written comments for this item?
Madam Chair, we do not.
Thank you. Hearing none, is there a motion to approve the minutes? At this time, I will entertain a motion. Anyone?
Madam Chair, this is Andy LaFever with ACJC. I move to accept the minutes.
And a second, please.
I can second Zach Altman on behalf of the Town of Gilbert.
Miss Amy, please take note of those two names at this time, the first and second. We will not take a voice vote. Members participating online can take part in the voice vote by turning on their cameras and unmuting their audio. For those who cannot do so, please turn on your camera at this time. We will conduct a roll call vote. Members, please leave your cameras on until after the call vote. Miss Amy? Can we have a voice vote for members? Those in favor say aye, and those opposed say no.
Aye.
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 Miss
When I
Amy,
call, oh, sorry.
go ahead, please.
When I call your name, please unmute and let us know your vote. Chrissy Hahn McDonald,
Approve.
thank you. Zach Altman,
Aye.
thank you. Cindy Patterson,
Aye.
thank you. Carla Babb,
Aye.
thank you. Monica D'Artenzio,
Aye.
thank you. And Emily Karen. I know you mentioned that your audio was not working. Okay, if there's a way for you to let us know your vote, that'd be great. Otherwise, Madam Chair, yep, I think we have everyone else. Madam Chair, the motion passes. Councilmember Ellis? I think her video might be frozen. Councilmember Ellis? Okay. All right. I will pick up from here, I suppose. At the last meeting of this council, we did receive a request to have a presentation on fatality review teams. Mark Perkovich, Associate Director of the Family Violence Center, joins us today to speak to the center's work. Mark, the floor is yours. Tyler, if you can please bring up his presentation. Thank you.
Terrific. Thank you again, Amy. Good afternoon, Madam Chair, members of the council. As mentioned, my name is Mark Perkovich. I'm the Associate Director with the Family Violence Center. I work under the directorship of Dr. Neil Websdale, who I think many of you know. It's nice to see some really familiar faces and names with Chris Shaw and Andy Lefevre, and I wasn't sure part of the council, but it's very nice to see you folks and certainly meet the others that I'm not with. So just a real quick background on the Family Violence Center. We're actually associated and affiliated and co-located at Arizona State University. And on the next slide, it shows kind of a more of a higher level look at how we're affiliated with the university. I don't know if advance the slide for me.
Tyler, oh, thank you.
Terrific. Yeah. So again, in the concentric circles, you can see Arizona State University whole. And within the university, clearly, there's several different colleges. We're actually incorporated into the Watts College of Public Service Community Solutions, part of the School of Social Work. And within that school, we do have the Family Violence Center. We're kind of a small but center. There's only about 15 full-time employees under the directorship, again, of Dr. Neil Websdale. And with the center, we work in 3 different programmatic areas that are funded predominantly through grants affiliated with the Office on Violence Against Women, OJJDP, STOP grants through our governor's office and so forth. And those 3 key programs are the ACASI program, which is the Arizona Child and Adolescent Survivor Initiative. They provide wraparound services to those children and adolescents who are left really in the wake of an intimate partner homicide or a near death suicide affiliated with domestic violence here in Arizona. That was an offshoot of a fatality review team that made that recommendation to address children and adolescents. And we'll talk about how the team's recommendations work and flow through our system players. The next program is the one that I'm here to talk today about. It's the National Domestic Violence Fatality Review Initiative. And then we have our appraise, which is our risk assessment that was modeled after the lethality assessment by Dr. Jackie Campbell. Research that was done over the years. That was incorporated into more of a community-informed risk assessment that was developed here in Arizona. And that's titled the Arizona Intimate Partner Risk Assessment Instrument System. And if I can get the next slide, please. And so as mentioned, the Family Violence Center, we're a nonpartisan center that engages in the following activities that you can see there. It's important to note that being a nonpartisan center, we're actually precluded from doing any type of lobby work. So if the teams here in Arizona or across the country are looking to make any type of legislative changes, obviously we recuse ourselves from that process. And I'll get into a little depth discussion about recommendations and what form they can take as we move through the presentation today. And next slide. So as I mentioned, the National Domestic Violence Fatality Review Initiative, we've been in existence since the early 1990s. I'm very fortunate that we've received continued funding through the Office on Violence Against Women. And what this really affords us to be able to do is travel to different communities and locations, both within Arizona and across the United States, providing training and technical assistance, much like today's meeting, discussing in deeper what is it really meant to do when we talk about reviewing domestic violence cases. It's really important to note that these teams are not, the purpose of the teams are not to reinvestigate a case. It's for the simple review, looking at system players, the interactions with one another, and then most importantly, the interactions or lack of interactions that the systems have had with victims and victim survivors. Next slide. And so just a quick look at historic origins of fatality review. Dr. Websdale was truly the pioneer of fatality review here in the United States. It started around 1992-93 with this first funding received from OVW back then. And as you can see, throughout the world, fatality review has really taken off and has grown. And even though we were one of the early pioneers here in the United States, we're now finding ourselves learning far more from our counterparts in the work being done in Australia, England, and most notably Portugal. And the latest development that we've had at the center is we're expanding that international footprint of fatality review by doing quite extensive work along with the college affiliates in El Salvador. And next slide. And so the whole purpose for domestic violence fatality review, teams are oftentimes assembled to identify and analyze homicides, near deaths, suicides, and other deaths caused by, related to, or somehow traceable to domestic violence. And these reviews can take a variety of looks as far as whether they're formal, informal, the number. We have teams here in Arizona and across the United States that sometimes review just on a quarterly basis, sometimes semi-annual, and then other teams that actually convene and case on a monthly basis. It's important to note and distinguish that the reviews being conducted here in the domestic violence arena is very different from child fatality review, which many of you all may be familiar with that process. Those cases are obviously reviewed in much greater number and with much greater frequency. And teams oftentimes balance some of their statistical data with cases that they know, past experience, there's certain issues that are present, and the team ultimately decides and selects which case they're going to review on a greater depth and detail to ultimately come up with their devised recommendations to be passed on for improvement and ultimately prevention. Arizona teams are actually governed here in Arizona through ARS Section 41-198. Most team statutes actually outline not only the team's construct, but also what their capabilities and their limitations are. Most importantly, almost every statute affords the team confidentiality, as well as insulation from being subpoenaed into any type of a civil or criminal arena. Because again, these cases are being reviewed and not reinvestigated. And so certainly we look to keep the organic portion of the, most oftentimes the reports that in the next slide that are obtained by the teams are delivered in their non-redacted organic form. And if we can take a look at that next slide. So team membership or composition, I mentioned that some state statutes actually identify specific members who are be assigned to the team. Other members are actually invited in by the as the team sees fit. This is a multidisciplinary team that's assembled most oftentimes under a city or state charter. Members are from the variety of that you see here with the heading: medical, criminal justice, social service providers. in our community. And the main point is to come together with these variety of lenses, to some degree review the case in great detail, and then obviously have a discussion about that case, how it through the specific lenses of those professionals in the room, and really play kind of a friendly devil's advocate when topics are actually discussed. Most importantly, the thing that we verify and ensure, we examine how is it or what is it that we know and how do we actually know that. So it's all backed with proof through reports data gathered by the team for the purpose of reviewing the case. And so I mentioned the team obviously sets out to review a case, a particular case that's of interest. These are just a couple of potential data sources. So most oftentimes relationships are built with the agencies that are seen here well in advance of the review being conducted, which really adds to the value of obtaining those records. With those pre-existing relationships, it's very easy to go to a department or a potential news outlet and actually procure records that they're in, that they actually possess in, again, its organic form without any type of de-identification or redaction. And next slide. And so our review philosophy is basically found in these 4 quadrants. As I mentioned, the system players come together for the purpose of reviewing a case to really examine and analyze what occurred between the parties that were involved. This is to be done in a no blame or shame type of environment. And the reason that's so important, obviously, we want clear, open communication in an arena of certainly trust and level of confidentiality. But also, more importantly, that we find cases that when they're reviewed, the system player that may have areas of improvement can shift from time to time. So it's so important to maintain those membership relationships without bringing in that blame aspect of things. But we do talk about accountability, and sometimes accountability for team members can be uncomfortable. There's, different times where, as a former law enforcement officer with Tempe PD, there were times when I sat on the East Valley team where, we could have done things better. So there is a level of humility to come into the room to basically say, yes, we erred in this area, and we look to make changes and improvements moving forward. We take lessons from other fields. In fact, the whole concept of fatality review was modeled after air crash or aviation crashes from the NTSB. As you'll see in a future slide, the pattern that the team takes when they're reviewing a case is almost correlates to the NTSB and how they venture out into reviewing an air traffic fatality. And then we look to obviously create that culture of safety, one that's safe and trust in a place and environment that we can have good discussions in depth about very sensitive issues, none of which, of course, leave the room. And when the team the final recommendation, their recommendations are done in a de-identified format. So there's no trace back to what case team actually reviewed, given any particular time or year. And so the ultimate goal for a team is to go out and provide the following deliverables. Every team starts after they gather the information for the case related. They'll establish a timeline. This is a chronological timeline that involves the parties that were directly involved. It can go back to the births of each of those members. It could even go back prior to that to look at the history and the lineage with the families that were involved, which may have contributing factors to what occurred in the intimate partner homicide being reviewed. Once that timeline is established, teams will go through that timeline and identify risk markers. We sometimes refer to these as antecedents or flags. These are the things that occurred in the relationship that might have given fair warning that the imminent risk was increasing, which is the relevancy of applying something like the appraise tool in the risk management and mitigation of the relationship in hopes of obviously prevention. The teams then progress into prior agency involvement. This is actually examining what type of engagement did the parties involved have. This could be with our social service system. It could, involve anything. Think of the system players that are here today. You each announced yourself. Oftentimes, you have engagement with folks that are involved in terrible domestic situations, And so we'll look at the degree and level of involvement that the parties have. We know from past cases and research, it's about a 50-50 split. Someone who finds themselves as a victim of an intimate partner homicide, 50% of those cases, they have had system contacts. In the other 50%, there's no contacts whatsoever on record. And then once the case is reviewed by the team, they actually assemble a report that includes their recommendations. Oftentimes, we encourage teams to be more than reasonable with the recommendations. For example, often number of domestic homicide cases involve firearms. Going after a change in firearm legislation may be just a little bit of a bite to take on at the team level. So we look a lot of the times for those changes and recommendations that can be done in our grassroots communities. Again, under the idea of the whole purpose of reviewing these cases is for future prevention. The teams often find themselves with questions. What questions remain? What do they want to ask themselves? What else can be learned from that case that was just reviewed? And how does that carry over into their next case that they're selecting and reviewing? And if I can get the next, please. And so, as I mentioned, the ultimate goal for the team is to generate a report. This is actually an extract from the statute that governs Arizona teams. And as you can see, once the reports are completed, they're distributed to the following offices and people: into the Senate, Speaker of the House of Representatives, our governor's office, the director in the Peace Officer Standards and Training Board, our state domestic violence commission, and our Chief Justice of the Supreme Court. And this occurs on or before the 31st of each year. And the main point of this distribution is obviously these are the folks who are stakeholders, but they're also change makers. So if there are recommendations in there that require any type of lobby or legislative activities, as I mentioned, we're precluded from participating. These are the folks that would come together to look at adopting these recommendations made by teams from their respective jurisdictions. And next slide. And so with that, I know that was very quick. Normally we spend about 90 minutes providing an overview of fatality review work, but that's our web address there. I think Amy has my contact information, both my email as well as my phone. I encourage you to reach out. We're currently seeing a dramatic increase of activities within Arizona. Like many other areas, COVID obviously had a dramatic impact on the team's abilities to review. We did do some work virtually, but it's nice to be back in person and interacting with these teams on that day-to-day basis. So with that, again, Madam Chair, I thank you, council members. Thank you as well. And I'm open to any questions that you might have.
Mark, thank you so much. This was so in-depth and very well received, I believe, because we needed to have a good understanding. And when you gathered all that information, what do you do with it? Where do you funnel it so that we could see some needle moving forward in the direction of improvement and better serve those people that are being reviewed? Thank you again for doing this. And I would like to thank the board for their patience, because my length send me back to the previous link that I had opened, and all of a sudden then closed the one that I was on. So Miss Amy, thank you so much for jumping in and forwarding everything forward. Any members at this time, do you have any questions or comments for Mr. Mark?
This is Samantha Hinchy with ACES DB, and I'm just curious what I know that like these have been stalled out for quite a while in most counties, but I'm just curious what you all think is like, what does the landscape look like in Arizona? I know ACES DB has recently become extremely invested in wanting to support the counties in developing these again. And I sit on the Cochise County one, which is the only one that's been turning one in since COVID, except for City of Phoenix this last year. So we're just really curious. Mark, I'll probably email you at some point because I would love to have a much larger conversation, but just wondering what you thought like the landscape right now in Arizona is.
Yeah, the one word would be reemerging. We had just recently engaged both Coconino County as well as Pima County, two of our counties that are obviously to the north and south that were once very, very active in fatality review. That went completely dormant throughout those years. And so it's really, really great to see that reemergence. Some of the former team members are still participating. but we also experienced that attrition of folks that were either retiring or switching positions, or so it is kind of a do-over, if you will. But the nice part about it is we're here, we continue to be here, we continue to get our so if there's location, Cochise included, if you invite us down to do any type of refresh or technical assistance or support to your we'll be first line. And again, the best part is it doesn't cost you or your team or your organization or your community a dime, which is terrific.
Perfect. Thank you, Mark. And just so you know, I'm probably going to email you next week just to come to have a larger conversation with ACES. So thank you.
Terrific. Thanks, Samantha.
Wonderful. Thank you again. And now, Miss Amy, let's continue to item number 6. We have been talking about the strong connection between domestic violence and mental health. As we will hear in the next agenda item, mental health is a concern throughout the broad range of human services. At this time, I would like to present Dr. Paula McCall with the Semicolon Society. She's joining us today to talk about her work and the impact of mental health on addressing domestic violence. I'm proud to say that Dr. McCall is one of our own here in Chandler. And Dr. McCall, you have the floor.
Thank you. And thank you, Councilmember Ellis, for inviting me to be a part of this conversation. So what I figured I would do, first of all, is I just wanted to give an introduction to who we are as Semicolon Society and kind of interweave in that some things that we have touched upon within the realm of domestic violence, and also opening up for collaboration and ideas and further efforts moving forward. So we can go ahead to the next slide. So just real quick, Semicolon Society, the semicolon is a symbol of suicide prevention because in grammar it continues rather than ends a sentence. So that's where our name is derived from. We are women directed. You'll see we're a small board of 3. Myself, Paula McCall, I'm a licensed psychologist and nationally certified school psychologist, also a trauma credentialed therapist provider. So I have a private practice and I do extensive work within the schools and within the community. We also have Sarah Hernandez, who is a licensed clinical social worker. And then we have Karen Hudak, who is a full-time itinerant vision teacher in the Chandler School District. So we come with a lot of background and experiences as far as, evidence basis and best practice. And we really just put forward in Semicolon Society as being a way to address and provide information and resources and presentations and conversations related to mental health, with the understanding that all form of mental health discussions are essentially suicide prevention. And that is our underlying root cause and mission, is suicide prevention and building those preventative pieces in our communities to help with that. So that's what that's really what we're doing. And we are only 2.5 years old. So while I've been doing community outreach in the area, and especially in the Chandler area, for well over a decade, the organization itself is still very young. And so we are constantly navigating and shifting how we're doing things and adding in things and working on our efforts. So if we go on to the next slide, I just want to highlight just a few things. We have a couple tiers of what we do in Semicolon Society as a nonprofit. As I mentioned last slide, we're all volunteer run. So we are navigating what partnerships we have and making sure that we're able to put in our best efforts into those partnerships, and really expanding. A lot of people have the misconception that we are a youth-based suicide prevention group. And that's because of my own personal experiences as a school psychologist, and my own background has been working with youth, but we work with all ages and with all backgrounds and all kinds of groups. So we've done a lot of community partnerships so far, and you'll see here in some of these pictures, some of these, everything from town halls and Forest City Days, and working with our community, working with our school superintendents, working with Intel construction workers. That's been one piece that we've taken on. And I highlight that too, because again, it kind of shows that we are very malleable. We have a lot of information and resources and connections related to suicide prevention and mental health awareness, and we're able to adapt and adjust those to whatever populations really need that focus. So, for example, working with construction workers, they're the highest group of suicides among employment groups in Arizona. And so kind of connecting with Intel, we've been able to establish a series of different presentations and connections that we've done with construction workers in the Intel community that we wouldn't have done otherwise without that connection. Just as a side note too, even though we are a board of 3, we have a large advisory council of over 80 people who are on our advisory council list. They're not always active. People come and go as they're able to participate, as well as a large group of volunteers. Probably about half of our volunteers and advisory council members are also mental health providers in some form. So we have a large range of experiences and evidence-based background trained experiences in different aspects of mental health and how mental health manifests across different populations and groups. About the other half though too is just as important because we have a lot of survivors and lived experience people, youth, community members as well. So that is how we make these connections and make some of these connections and drawings into different populations is by tapping into the vast amount of experience, expertise, and background that we have within our very strong volunteer and advisory council basis. So if you go to the next slide. Oh. So that first slide was about community partnerships. So that was about us connecting with other community groups, other organizations, and other nonprofits and things like that. We have made over like 150, I think, connections with other organizations and nonprofits. We don't believe in reinventing the wheel. We want to work together with what's already present and add to those pieces. The other element that we have done though too is we have worked on identifying areas that really help service our own community through events and education. And we have what we call the Community Hope Project series, which is a series of events that was established back in 2023, I guess would have been our first event. And we do them once every couple of months. We target the Chandler community because we believe that rather than just doing one large event occasionally, if we keep targeting the same community in different ways and in different aspects and touching other people across these different types of experiences and events, then we're able to really build a stronger community, a stronger, more resilient community. And so that's what we're trying to do through our Community Hope Project series. So what that is a series of events, and it ranges, you'll see different pictures here, from restaurants and rock painting to flower planting and yoga. And we actually just finalized a concert event that's coming up at the courthouse in downtown Chandler in February. Super excited about that. Every event is about bringing in people open to the public to talk about and connect with resources related to mental wellness and suicide prevention, to destigmatize the conversations and discussions that we are having, to bring forth areas of concern and challenge that we have, and to just connect people with each other, especially following the pandemic. There's an epidemic of loneliness and isolation, and really just bringing people together to connect, and to connect with something that is resilient and resiliency building. So like, for example, we just did a yoga event. It was all our events are completely free. We gave out t-shirts, we had resources available for people, and we gave people yoga mats so that not only did they engage in that class, but then they were able to go home and have that tool to continue to engage in that kind of positive coping strategy as well. So that's one of the things that we do, and that is an ongoing thing. So we take input from the community, from advisory boards, from members. We've done surveys in the community to say, what kinds of things do we need to focus in on? What kind of conversations do we need to have? And what kind of events do we need to bring to pull people together? So that's one of the ways that we can translate over into domestic violence issues, is how do we have more of those conversations related to that? Or how do we reach communities that may have those impacts and need further resources, especially after the fact? One of the things I found that previous presentation really interesting in that conceptualizing of, just that trajectory of impact with domestic violence. And it's not just about right in the midst of that, but it's also about the ongoing traumas. And even when someone gets out of that physically dangerous situation, the impact of that trauma on the family in recovering and moving forward still puts them in high risk. And how do we connect people to resources and connections and conversations to help with those as well? The other piece that we do is a parent education piece called Tuesday Talks. It runs October to May. We're in the second year of that. Second Tuesday of every month, we use the ASU Chandler Innovation Center to have an in-person place for parents to come free of charge, It's a different topic and different speaker every month, along with a free meal and resources, just an opportunity to connect. We have various topics. We survey the community on what kinds of topics are needed. One of the topics that we did just have back, I believe in March, was about the impact of trauma. And we talked about it from a parenting perspective. How does our trauma experiences as a parent and affect our parenting? And how can we use that? How can we navigate through that? So again, another direct relation into how these pieces carry over with domestic violence and mental wellness. So you can go ahead and go on to the next. I pretty much already summarized this. These are just some examples of some of the different community hope projects, things that we've done. We like to show up and pop up where people don't expect us. So we've done like a coffee connections. We've shown up at farmers markets just with our information so that we're not only connecting with people who really want to engage in mental wellness, but also with people who may not realize that they need that connection. So we try to be all around there. And I've already mentioned the different types of topics and things that we've done with our parent education series, which is still ongoing. So we can go on to the next. One example of collaboration that we've done is Embracing Wellness, which was January 2024, where we partnered with the city of Chandler to develop to just come to fruition an idea of how to bring community together in different aspects. So we had all different kinds of activities, from martial arts to live music to painting to yoga, tons of resources and things like that, just to bring people together. So I just wanted to show this as this was a kind of a one-time event that we did in collaboration with the city, but it was like, hey, here's a space, here's this time, what do we do? How do we need to tailor it? And we used input from the community in figuring out what that might look like. So that's another example of how we can, and we're actually working on some collaborative pieces with some other organizations as well right now, and how to make and tailor these types of events into the population that's being targeted. So, and then go ahead to the next one. Our other piece is that every year in September is Suicide Prevention Month, and we host a it's getting larger, it doubled in size this year, Suicide Prevention Week gathering and vigil. And this is an opportunity for the community to come together. It's a Sunday of Suicide Prevention Week every September, where we have a large resource expo. We had over 40 organizations tabling this year, providing resources and connections across all different aspects of mental wellness, and even things like volunteer work opportunities to connect people with different aspects of things that they can use and utilize depending on what they're coming with into that space. We had live music, food, activities, henna, t-shirts with messages of hope, and so on. And then the last hour of this event, we shift into a candlelight vigil where we have speakers and we have moments of silence to remember those that we've lost to suicide. One of the biggest challenges of suicide loss is the fact that it is so stigmatized and people are so afraid to talk about it and reach out about it. So this, if nothing else, provides an opportunity for people who have lost someone to come together in a safe space where we all have that connection and to be able to talk about and remember the person that they've lost and loved. That is another piece that we also do at Semicolon Society, is we do offer some postvention, so following a suicide supports, whether that's conversations, or we just this week with the school district provided a parent education and Zoom on how to support their youth following a suicide loss in their school community. We do kind of the whole spectrum from prevention to postvention, knowing that all those aspects are so critical in further preventing suicide down the road. So I think we can go to the next slide. So just to kind of summarize, we in 2023 is when we started really becoming active. We were organized and became official in June of 2022. So in 2023, we connected with nearly 2,500 community members across various activities, whether it's tabling with resources to presentations to postvention supports and so on. And in 2024, we have already made over 3,500 connections with 45 events that we've either organized or been a part of in some way. And we have a lot of things coming up, including multicultural festival, walks, presentations that we've been asked by other groups to do. We will tailor presentations. For example, we have a Girl Scout group that wants us to do a presentation simultaneously to the Girl Scouts and the parents about suicide prevention and then pull them together. We are going to tailor that directly to what they need. We're also doing collaborations further with Intel, with Camp Notawees, which is an asthma camp for youth. Cooper Vision is trying to do a large large, and again, these are some examples of how we're collaborating to help build up what's going to work best to meet the mental health needs and provide those resources that people need within the targeted population. And we're going to continue our Community Hope Project series again with our next one coming up in February 21st. So there's lots of ways to collaborate with us, and we're open. We're so young. We're so open to conversations. We're active and we're fully invested. We do tabling and resources all the time, providing connections at other events that other people are hosting. We can target presentations and design them by mental health providers and experts. It's not always me. We have a whole lot of experts in our group, so we can reach out to each other and figure out who's the best for certain topics and situations. And we collaborate and help people connect with resources when needed. We don't provide our own therapy services or crisis line, but we will connect people with resources and help them identify and find providers if they're struggling to do so. And we're just open to brainstorming. So that's really, that's kind of where we're at. So I think there might be one more slide just with contact information. Maybe, I think there's one more slide. Oh, there we go. Yep. So just some more wonderful pictures of us. A lot of the pictures on this are very early pictures before we even had tablecloths to our name. But great. We really become kind of a family of our own. We check in on each other. We're all there and passionate for our own reasons. And so it's also a great place to connect people if they just want to get involved in the community as well and be a part of things, because we really do care about each other and have developed a great support system among ourselves. So the email that's listed on there, the admin email actually goes directly to me. And then we're also on Instagram and Facebook, and you can see I just updated some of our information on our website last night. So
Thank you so much, Miss Amy. This was really great to know that you exist out there and with such great, so many resources for us in the community. At this time, the question that I have, I never really thought about this. You mentioned working with Intel and with the construction that is going on right now, booming in Arizona for years. I've never thought of that population as being one where we would have seen so many, greatest amount of suicide. Can you explain why do you think that is happening in that context?
And that's interesting that it's great that you asked that, because I did ask the same thing when we had a presentation. One of the construction workers said, "Why are our rates so high?" And I said, "You tell me. You tell me why the rates are so high." And we had a great dialogue conversation about all the different factors, the frequency of shifting job to job, so not having necessarily that core, or having jobs that are away from family or that keep you away from family. You have a lot of injury, and so you end up having a lot of opioid addiction within that as well. You also have construction is a lot of veterans go into construction following service. And so we have, of course, a very high suicide rate among our veteran population as well. So you see a lot of overlapping factors there. Oh, Christine, you're muted.
Thank you so much for joining us today. Really appreciate it. Do any members have questions or comment at this time?
Okay, I do. I'm sorry, I always have questions. I was just curious if, like, when you're talking out in the community, like, are you talking about like things that not trigger, but like things that are contributing factors to suicide or mental health? And is healthy relationships one of those things?
Yeah, so each event that we do, each conversation and presentation that we do is a little bit different. In our Community Hope Project series, we've been trying to target different aspects of things. So like, for example, one time we did an event, and it was at Burst of Butterflies in downtown Chandler with like arts and crafts and things like that. And we had tabletop conversations about hope. And through that, we were educating people that, hope is such a key piece in suicide prevention. And how do we find hope, and what does that mean? We've also had topics specifically related to self-care and what is self-care actually. And so So healthy relationships would absolutely be one of those. One of the things with our Tuesday Talks Parent Education series, we're actually our next one in December is talking about boundaries. And again, it's not just about how parents help kids have boundaries or how to have, it's about parental boundary, myself as a parent, as an individual, how do I hold healthy boundaries? Because I'm the model for my children of holding healthy boundaries. So within that comes with, so there's a lot of things that are mixed and interspersed in there. And so it kind of depends on the situation. If we're presenting for a group or organization that want us to, we always have a conversation with them about what are the key pieces that you want, that you feel like your group needs to hear and what needs to be targeted. And so we will adapt and adjust with that as well.
Thank you.
Another thing, maybe people might be thinking about it, but not asking. I know in the past we have heard the stigma that if we talk about suicide, that's going to incite people to have those thoughts and go out there and do that. Is that something that you can speak about a little bit? Because I think for me, the more silent we are, the more these things will be happening, and then we will not be able to take care of it versus having conversations about it.
Yeah, that's one of the most prevalent myths that's been debunked for years. Because in fact, having conversations about suicide, one, if someone is struggling, it provides an opportunity and communicates support and a desire to be present, and it can help increase conversation and connection. And on the flip side, if someone is not struggling, it doesn't put the idea in their head and it doesn't lead them in a direction that they weren't already in. So absolutely. Conversations destigmatize, and it's huge. It's amazing when we do our tabling events. When we have so many people that will come up to our table and realize that we're about suicide prevention, and we'll look at our resources. And then we have so many people circle back around and will come back with stories to share about, I've never said that this person in my life died by suicide until right now. I've never had that safe space to provide that. And it's really powerful to have that. And then when people are able to connect to and say, yeah, we're not alone, is really powerful. I will, on a side note of that, just note that at all the events that we host and whenever we table, we always have mental health providers that are present who have crisis experience response. And when we run our events, we always have a crisis plan in place for anyone that might need additional supports.
That's wonderful. We really appreciate you being here today and let us know what you're doing out there, that we could actually access that for our own communities. Thank you again, Dr. McCall.
Thank you for
Appreciate
having
you.
me.
Thank you. And now we proceed into agenda item number 7. It is important to have a clear strategic direction if we are going to continue to the success we celebrated at our last meeting. In October, Ms. Amy mentioned the regional assessment underway. Today, she will offer the latest updates on the assessment. We will have an opportunity to talk about how we will conduct a deeper dive to identify a strategic direction for this council. And now, Ms. Amy, you have the floor. Thank you so much.
Thank you very much, Madam Chair, members of the council. If we can go to the next slide, please, Tyler.
How are we doing on time, Miss Amy? Good?
We are doing pretty well. I'm going to go through these and then we have one more presentation after this.
That's awesome.
So thank you. We are scheduled for an hour and a half. If some folks are needing to drop off, please let us know. And I am monitoring the chat, the participant list to make sure that we maintain quorum. Thank you. So the Human Services Division has been around for almost 50 years, and obviously a lot has changed over that time frame. The Regional Domestic Violence Council was formed 25 years ago, as we just celebrated in our meeting back in October. The continuum of care has come to MAG in that time frame. Your communities have changed. The way that we approach domestic violence and human services has changed. So it's just a really important opportunity to be able to take a step back and just assess, are we undertaking regional coordination around domestic violence planning in the best way? Are we meeting your needs? Are we addressing your priorities? And so your input is really important to this process. So we mentioned this at our last meeting, wanted to go into a little bit of a deeper dive to share with you what this assessment is all about and some of the early results, and then to get your input, your insights on where we might go from here. And this item is slated for action. If you can go to the next slide, please. So we have 3 goals for this assessment. And the first one really is that alignment. It's to make sure that we're aligning with you, that we're helping you to achieve your priorities as it relates to addressing domestic violence. having that understanding will help us to articulate what is the North Star for our work together collaboratively. What ultimately are we trying to achieve, and then what are the steps to arrive at that destination, knowing that those steps may change over time as different needs and opportunities emerge. And then from all of this, then to be able to refine the staffing and the committee structure. I would note that right now we have 4 committees within the Human Services Division. One is the Continuum of Care, which is addressing homelessness. That is kind of on its own track because they have a very clear mandate from HUD. They have very clear direction on what they should be doing. They're going through their own planning process right now. So we're informing, we're integrating, but they are moving on their own direction. The other 3, though, are very much part of this assessment, and that's this committee. It's our Human Services Technical Committee, which are the staff from the local and tribal governments, as well as the United Way and DES. And then our Human Services and Community Initiatives Committee, which is comprised of the council members from our local and tribal government. So particularly for those 3 committees, we're really looking at the committee structure. Is this the right structure? Are we able to really invest our time and our collective energy into taking action together? And so that is up for discussion, and would love to get your thoughts on this throughout this whole process. And then we want to make sure that once we have that committee structure, we have the appropriate staffing levels to move work along in those areas. Next slide, please. So this is a process that we've been undertaking then, and there's really 4 main activities. The first one is a listening tour, and that is on your agenda today for action in terms of doing some interviews that are very specific to domestic violence stakeholders. We've conducted more than 24 interviews already, and those have been primarily conducted with local and tribal governments, and also a handful of community partners such as local foundations and ASU. It is important, though, to make sure that we're hearing from the domestic violence community, and so we do have that on your agenda for action today. We do have 2 surveys that have completed. One was with human services stakeholders and committee members. And we had about 14% of our respondents were from the Domestic Violence Council. So thank you for your participation in that. We also had another survey that went out to the city and town managers, county managers, members of our management committee, because we wanted to hear from the leadership of the local and tribal governments in addition to the human services practitioners. The data collection phase will end this month. We're starting to wind down on the number of interviews for the general human services assessment, but we do want to talk with you about conducting some additional interviews above and beyond that next month that are more specific to the domestic violence community. Starting next month, we will continue analyzing the information. We've started a bit, and we'll be able to share that analysis with you. But really wanting to do a deeper dive into that analysis so we can identify any trends, any gaps. We've already seen some themes emerging, and we can share those with you today. And then moving into that mission and structure development to make sure that we're positioned to be able to undertake the work that's important to you and that's important to the region. Next slide, please. So that listening tour, this is in terms of the regional human services assessment and does not yet include the domestic violence stakeholders. So we have conducted or scheduled 33 interviews. The majority of those have actually been completed. We do have a handful more to schedule, and we'll be doing that for the regional human services interviews through the end of this month, and then we'll be starting in on any domestic violence interviews within the next month. Next slide, please. These are some of the key trends so far that we've seen from the regional human services interviews. When we have been listening to folks, they've talked also about domestic violence, but housing and homelessness have been first and foremost for a lot of folks, but that includes priorities for people experiencing domestic violence as well. Many of them are experiencing homelessness in addition to the domestic violence that they've encountered, and many of them also need housing. So these issues aren't mutually exclusive. They very much overlap because people are living their whole lives and not in silos. And so it's important that we take a very holistic approach to this. As we've been working with the local and tribal governments, it's been important to understand that they're coming to this conversation from very different places. Some have very robust human services programs, and they have a whole department and number of staff. And others, when we talk to them about what are the priorities for a human services department, they don't have a human services department, but their residents have needs. And so instead of talking about human services as a sector, we're talking about the needs of the people living in their communities, and that really resonates. And ultimately, that's really what this is all about. It's about meeting people's needs. And throughout all of this work, we've seen a significant tie between human services and transportation. I can tell you from focus groups I conducted years ago with people who have lived through domestic violence, one of their biggest needs was transportation. And so we're just keeping that on the forefront in all of this analysis. We're thankful to hear that our work in data and collaboration is valued, and we're eager to be able to continue that strong partnership with you. We also want to hear what's not working, and a little bit more to come on that in just a moment. A new area of activity potentially for MAG is to be able to assist with cooperative procurement. So wanting to reduce the administrative burden that you might have within your agencies. So if there's goods, services, or products that you're wanting to procure, maybe we could do that together as a region. And there's different kind of phases to that where we could slowly step into that space, and eager to be able to explore that with you. But ultimately, out of all of this, people, even when they love our data and the research and all of that, they want to take action. They're saying, hey, I love this best practice information. What do I do with it? And so we're really looking at how do we position. Thank you, Celeste, for letting me know that you're leaving. And so we're really wanting to position this so that we can take action together, and that we're positioned to be able to support that activity. Next slide, please. So these are the demographics of the survey respondents. We had 64 on the human services side, 38 from the management committee side, although the total universe was much smaller on the management committee side. So that means we've heard from 90% of local and tribal governments, and that represents more than 96% of the region. Next slide, please. Again, 14% of our respondents were from the Domestic Violence Council. So thank you for your responses. It's important to keep that representation in mind as we look at the results, because that does shape how people respond. Next slide, please. Funding above and beyond is people's top priority. It doesn't matter if you're a city manager or working at a small nonprofit. What you need to address human services requires funding. And so we hear that loud and clear, and we're looking at how can we support you to make more resources available. Next slide, please. Homelessness, domestic violence, housing, among the top issues. When we ask people, what are your top issues? This is what they said. And so you can see that varies a little bit from the human services folks to the city managers, but ultimately it is these three top issues in terms of being that top priority. Next slide, please. But interestingly, though, when we ask people what are your top three, mental health really rises to the top. So we just heard a great presentation on the mental health needs, understanding how cross-cutting that issue is. It's not confined to any one sector or population. And so a conversation that we can have together is how do we address mental health potentially as it pertains to domestic violence. Next slide, please. When we ask people, what are you doing to address human services? This is what they talked about. It's a broad range. I would call your attention to the research bars, because those are relatively low, which kind of makes sense, right? If you're a small nonprofit, you may or may not be engaged in conducting research. But if we go to the next slide, that's very much a space where they see MAG. And that's good for us to know, because if you see MAG as occupying that research role, then we want to align our activities and our staffing along with that. There's a broad range there, and all of this can be used to help inform our actions moving forward. Next slide, please. We also asked people, when has MAG been effective? This is these are the highlights of what they said in terms of homelessness and domestic violence, housing, services. And so it's good to know where we are successful in our actions. And the next slide, please. And then framing this in another way, we ask folks to rank us, to rate us, and let us know how effective are we in this space. Now, it's great to know that the majority of folks, whether you're city managers or human services stakeholders, think that we're doing effective work. I would call your attention, though, to the neutral category, and that concerns me. I kind of see this as a challenge. I accept this as a challenge to say, there's a good portion, about a quarter of people were neutral, and that can mean that they don't have an opinion. But often it means that they're just trying to be nice, and they don't want to say that they don't see us as being effective. So my goal then is to be able to be more effective in this space. And to do that, we need to realign and restructure the way that we undertake this work. Next slide, please. And so then the next steps, it's interesting as we start pulling out the the survey responses from our domestic violence stakeholders and council members, in large part, they really aligned with the overall survey responses. So funding, for example, was the top priority for the DV stakeholders who completed that survey. Also very interested in the data. Again, I think a lot of people see MAG as occupying that data and that research space. So that's important, and that's something that we want to continue. Also, interestingly, though, is not all of the survey respondents from the Domestic Violence Council cited domestic violence as their top priority, which just shows, again, the need to remove silos, because while we're working in this domestic violence space, it's not all about domestic violence. It's about mental health. It's about housing. It's about it's about poverty and income. So it's about all of these different issues. So how do we structure ourselves to get out of our silos and address issues maybe more holistically? So that can be some food for thought. We do have that goal planning document for your action today and the interview guide. If you'd like us to conduct some additional interviews that are more specific to the domestic violence community, let us know. We're happy to undertake that work with you. If you'd like to conduct interviews and then send us the results, that's great. We can also conduct interviews. If you have some recommendations for who we might talk to, we'll certainly reach out and are open to anyone from this council who might like to participate in an interview. And if you might like to recommend others as well, that would be fantastic. And then really looking forward to developing those recommendations for how we might enhance the work in domestic violence to have a stronger strategic direction. We've accomplished a lot over the past 25 years. A lot of that has been very much grant driven. And we haven't had grants for a few years. So that's another area of growth for us, is how do we make sure that we have the capacity that we need in order to undertake meaningful work. If we can go to the next slide, please. I think that might be the last one on this. Yeah. So so the action then before you today, if you so desire, is to approve the stakeholder interview guide and that planning, the planning document. Happy to have any questions, any changes, and really eager for your input. Madam Chair, that concludes my presentation.
Thank you so much, Ms. Amy. Do any members have questions or comments? Staff, do we have any written comments for this item?
Madam Chair, we do not have any written comments.
Thank you, Ms. Amy. Hearing none, is there a motion to approve the minutes? I would like to have a motion on the table. Anyone, please?
This is Kevin Mattingly from Phoenix FAC, and I'll make that motion.
Thank you, Sal. And I would like to have a second at this time.
This is Carol Park Aiden at Community Legal Services. I'll second that motion with enthusiasm.
Thank you. Thank you so much. Ms. Amy, please take note of the names of the first and second. We will now take a voice vote. Please turn on your cameras and unmute your audio. For those who cannot or do not want to turn on their cameras, we will conduct a roll call vote. Members, please leave your cameras on until after the roll call vote. At this time, can I have a voice vote from members? Those in favor say aye.
Aye.
Aye. Aye.
Aye.
Those opposed say nay. Ms. Amy, can you please take a roll call of the members participating virtually who did not participate in the voice call?
Yes, Madam Chair, thank you very much. Andrew Lefevre, how do you vote?
Is still with us?
Okay. Kyla Babb, how do you vote, please? Kyla, you're muted. Monica, how do you vote, please?
I will be abstaining from this vote as I was unable to garner Councilmember Tilke's position on this.
Thank you. Emily Karen, I did receive your message that you vote in favor. Patricia, how do you vote, please? Okay, Madam Chair, the motion carries.
Thank you. With a motion and a second, the motion passes. Thank you so much for the motion as it carries. Now let's go to item number 8. We are excited to welcome Ms. Jody Hector back to talk about their recently renewed grant to address late life abuse. Ms. Jody, the floor is yours.
Thank you so much. So hi, everyone. My name is Jody Hector, and I'm the program coordinator for the Abuse in Later Life Grant Project within DES. DES was awarded this grant in 2020 for 3 years, plus 1 extension year due to COVID delays. And then this summer, we applied for a continuation grant, and we are awarded 3 more years. So today I will give a quick overview.
Good night, drive safe.
Oh,
Somebody is unmuted.
so today I will give a quick overview, and if you have any questions, you can raise your hand or we can just wait till the end. Okay, perfect. Oh, go back 1, sorry. Oh, it's out of order. All right, let's go to the next one. All right, so there we go. Let's do the overview one. That's next on my list. Okay, so quick overview. So the Office of Violence Against Women, that's OVW, was created in 1995, and it serves under the Department of Justice. So this grant program is authorized by the Violence Against Women Act and provides national leadership on issues of domestic violence, dating violence, sexual assault, and stalking. So overall, this OVW grant supports a coordinated community response to hold offenders accountable and serve victims age 50 and above. So for the 2020 grant, the definition of abuse in later life has been updated. Just a couple words have been changed, so I'll let you read it for yourself. They changed financial exploitation to economic abuse, and then they added on at the end, willful harm committed against victims who are 50 years of age or older. So the definition has just changed a little bit. I just wanted to note that. Okay, next slide. Can you go, I'm sorry, can you go back to the MOU one? I'm so sorry. My notes are out of order. Okay. So in 2020, we had 4 MOU partners, Memorandum of Understanding partners. And in 2024, now we have 9. So there were 4 areas that are required by OVW. So we needed at least 1 law enforcement agency. So we have 2. We have Maricopa County Sheriff's Office and the Arizona Attorney General's Office. We needed 1 prosecutor's office, and our MOU partners, Maricopa County Attorney's Office. We needed at least 1 victim service provider. So in this grant, we have 3, which is a New Leaf, MAG, and ACES-DV. And then we needed at least 1 nonprofit or agency that assists individuals 50 or older. And this round we have 2. So we have DAS, which is the Division of Aging Adult Services, which is under DES. And also the Area Agency on Aging will continue with us. And then we also have a priority area was a new priority area for the 2024 grant. And that we have 2 MOU partners. We have Arizona Faith Network and Lutheran Social Services of the Southwest. So those are our 2 priority areas. Okay, next slide. Okay, so as you can see, we have 9 MOU partners, and we also have 14 letter of commitment partners. So MOU partners are required and written into the grant. And both MOU and LOC partners write letters of commitment agreeing to collaborate, attend the CCRT meetings and trainings. I'm not going to obviously read them all, but here's a list of all the partners. I just wanted to note that you do not have to be an MOU or LOC partner to attend the monthly meetings or trainings or to collaborate with us. We do have many organizations that attend those meetings, but they don't have a formal agreement to do so. So I just wanted to let you know if anybody's interested. Okay, next slide. Okay, budget approval. So currently we are waiting on a budget approval for the proposed budget within the grant application. So once that is approved, we will begin the planning phase of the grant. But right now we do not have an approved budget, so we cannot start any of those projects. Okay, next slide. Okay, primary activities. So as you can see, the 2024 grant is mostly about training and cross-training. So there will be training for first responders, law enforcement, prosecutors, and judicial staff. There'll be training for organizations working with the elderly, including shelters, cross-training for faith-based partners. We will have outreach on awareness and prevention of elder abuse throughout Maricopa County. There will be direct services for victims of late life abuse again, which are 50 or older. We will update and create resources to use in outreach and awareness campaigns. And then we will have an additional focus on underserved communities such as refugee, immigrant, and tribal populations. Next slide. So we have, we're required to have monthly CCRT meetings, which is a coordinated community response team. So we will continue that. We have continued that in this grant period. The CCRT focuses on training, conducting community needs assessments, to identify and provide appropriate services. Right now we have about 60 people and over 30 organizations listed as partners. We focus on the 4 crimes as written in OVW. That is domestic violence, dating violence, sexual assault, and stalking. Okay, next slide. So a little more about the priority areas of the underserved communities. So we will focus on the tribal, refugee, and immigrant communities in collaboration with the CCRT to create ways to end late life abuse. The focus will support the improvement of outreach services, civil and criminal justice responses, prevention, and support for survivors from historically marginalized and underserved communities. Next slide. Our outreach and training will include several organizations to conduct those trainings over the next 3 years. So as written in the grant proposal, we propose that ACES-DB will provide training to direct service providers, especially the DV and SV shelters and transitional housing facilities, so that all of those facilities can and will accept a safe place for victims of late life abuse. ACES-DB will also provide training to our faith-based communities and underserved communities such as Arizona Faith Network and Lutheran Social Services of the Southwest. And then Maricopa Association of Governments will train partners virtually on topics related to late life abuse and will provide outreach on prevention and awareness and also host a caregiver summit as written in the grant. Next slide. We also have other training, including Safe Havens will provide a training to those faith-based communities that serve immigrants and refugees. The Arizona TASA, the TASA workforce, I put that wrong. The Arizona Attorney General's Office provide a virtual cross-training to first responders, law enforcement, prosecutors, and the courts on the topic of abuse in later life. And the Attorney General's Office will also provide a consultant with Futures Without Violence for further enhancement of training to first responders. And then the Arizona Faith Network will conduct training to their network of faith-based leaders and communities. As part of the Social Justice Committee, we'll also coordinate with those communities to get the word out to all those underserved areas and including the LGBTQ+ communities. Okay, next slide. And then we also have some required training by OVW, and first on the list is the new grantee orientation, which will be in January 2025. And at that training, there will be 6 of us attending the training from the MOU partners and DES staff. And there we will get all of the direction on our next steps and how to create a continued plan for the next 3 years. We also are continuing that law enforcement training. They're self-paced modules, the basic and advanced, and anybody can take those trainings. By the way, if you want more information about those, please let me know. And then there will be a prosecutor training and a judicial workshop in the next couple of years and a direct service provider training. Next slide. Okay, as part of the grant requirements, we have to provide direct services for victims of late life abuse, 50 or older. 33% of the grant funds must be directed to direct services. So because we are a continuation grant, we are called enhanced services, and our new direct service, or one of them, will be a New Leaf. It's a domestic violence program. It will provide services for the disabled and elderly who need emergency assistance. We have not created the plan yet. That's something we have to do within the CCRT, so that will be coming soon. A New Leaf currently holds the DV STOP program, which is a hotel motel program, and that's what we provided in the last grant cycle. We provided hotels to those who needed a safe place to go. It may include other organizations and options for housing, emergency services, and shelter. First, we need to complete that critical assessment, write a strategic plan, and then wait for approval from OVW. Okay, next slide. Okay, that is it. So that's the last of my side. If there are any questions.
Thank you, Jody, for joining us today. This was amazing. Any members have questions or comments at this time? Hearing none. Are there any future agenda items right now? Going on to item. Anyone has any future items for us for the next agenda?
Madam Chair, this is Andy.
Yes, sir.
Thank you, Madam Chair. If I could, I'd love to give an update or provide some information on our ACJC and Cox Communications Gun Safety Saves Lives public service campaign.
That's great. Okay. Miss Amy, also, I was thinking about CC Hope Center, an organization that provides help and also shelter to women that are taken out of human trafficking. I can send that information to you to see if we can reach out to them and see if they can do a presentation for us, because they're in that space. That's definitely domestic violence and all these things that happen into that area. Anyone else at this time? Any other agenda items for next time? Okay, hearing none, let's go up to item number 10. Any updates? Does anyone have any brief updates or news to share with the committee at this time? Well, you're a bunch of very silent people today. Nobody has anything else they want to contribute. Well, hearing none. Well, this is the time where we will say we have concluded the meeting. That concludes our meeting today. We wish you all a happy holidays. And those of you who celebrate Christmas and Hanukkah and anything else that you celebrate, please enjoy your time with your family. We really want to continue the work that we have done together with you. And as we go into 2025, let us continue to join hands together and do this great work together for all of us here in the city.
Thank you very much, Madam Chair, members of the council. We will be sending out the committee dates for 2025 soon. If you need anything or have any questions, please don't hesitate to let us know. Thank you very much for your time today and for your continuing partnership.
Thank you.